Welcome to Lessons in History. The yellow today is, why was surgery such a pain? In this video, we will look at the monumental advances of anaesthesia and germ-killing antiseptic techniques of the mid-19th century. The issue of pain will be swiftly dealt with by the likes of Morton and Simpson, followed closely by Semmelweis and Lister, who will mop up the dirty crumbs. Believe it or not, this video does contain some haters. Opposition to both anaesthetics and antiseptics will be highlighted for their hindrance to medical progress. Timestamps are in the video for the topic that you find most painful. Today, no person of sound mind would choose to be operated on without pain relief, nor would they choose to be operated on in filthy, germ-ridden conditions. But before the mid-19th century, this was the reality faced by patients. General anaesthesia renders the body temporarily unconscious and unresponsive to stimuli. It allows the surgeon to work on a still body without the patient screaming or rolling around in agony. The first successful public medical demonstration of anaesthesia, in which dentist William Morton used gas ether, occurred on October 16, 1846. The era of modern anaesthesia begins on this date, and is celebrated each year as World Anaesthesia Day. But, like most other medical practices, anaesthesia has a long and colourful history. As any adult watching this will know, alcohol blunts the senses. Falling over, the cold weather, or even breaking a leg feels much less severe after a few drinks. As alcohol masks stimuli such as pain, therefore, throughout the ages, having a drink was common practice before surgery. Other methods before the mid-19th century included packing ice on the body, being given a knockout blow to the head, even strangling the patient to the point of collapse so that they would not feel the pain. Even hypnotism was used in an attempt to numb the pain. From the 16th century, opium, the key ingredient in morphine, also became popular in Europe, having travelled from Asia. Influencers such as Paracelsus and, in the 17th century, Thomas Sydenham combined opium, alcohol and other ingredients to produce laudanum, which essentially was a weak form of morphine that became heavily addictive. All of these methods were overshadowed by the events of the 1840s, which changed the course of anaesthesia for good. A number of discoveries beginning in the 16th century in Europe led to this moment. In around 1540, German scientist Verillus Cordus discovered how to make ether from ethanol and sulfuric acid, and consequently, this volatile liquid became available. Wandering physician Paracelsus, who had earlier created laudanum, noted that adding ether to food quiets all suffering without any harm and relieves all pain. But he made these observations in chickens. By the late 18th century, ether vapour was being inhaled for pain relief, and, later, ether frolics. At these gatherings, participants inhaled gas and entertained the audience with their giddy, confused antics. Remember, this is the history of anaesthetics, and was certainly not commonplace, never mind thinking it would be available for you if you needed to have surgery. In the 1800s, English scientist Humphrey Davy reported that inhaling nitrous oxide not only caused uncontrollable laughter, he dubbed it laughing gas, but also helped deaden pain such as toothache. Laughing gas, or N2O, does not render the body unconscious, and unfortunately, Davy only pondered medical application and did not take it any further. Instead, he opted to use it as a recreational drug. In the US, ether frolics and laughing gas parties became popular in the early 19th century, especially with students of chemistry and medicine. Some students noticed that painful injuries sustained during these frolics seemed not to trouble the participants. Going on to qualify in medicine and dentistry, and remembering the apparently analgesic effects of these two gases, they reasoned that a larger dose could work as an anaesthetic during surgery. In December 1844, dentist Horace Wells watched a nitrous oxide stage demonstration. He was intrigued to see that one of the participants was injured, yet seemed not to notice nor care. Trying it out on himself, he had a colleague remove a wisdom tooth. The experiment worked, and Wells started to use nitrous oxide on his patients. Anxious to prove his success, he arranged a public demonstration of his new technique at Boston's Massachusetts General Hospital in January 1845. Sadly, the plan backfired, and the patient moved and groaned during the operation. Despite his continued efforts to champion the method, he failed to regain his credibility and committed suicide 3 years later. In December 1846, Wells's former partner and fellow dentist William Morton, who had helped to arrange Wells's failed demonstration, began using ether to anaesthetise his patients. Encouraged by earlier successes, he too set up a staged demonstration at the Massachusetts General Hospital. On October 16th, Morton administered ether to a patient whilst leading surgeon John Collins Warren partly removed a lower jaw tumour. The ether worked. The patient, Abbott, did not cry out or react to the surgery. Medical observers were impressed, and news spread rapidly. The era of controlled general anaesthesia had begun. This spread to Europe. British surgeon Robert Liston was keen to use this new technique and did so in a leg amputation in December. An effective anaesthetic had arrived. However, like with nitrous oxide, ether had its own drawbacks. It was difficult to inhale, caused vomiting, and was highly flammable. There was still need for a safe and effective anaesthetic. Up step Dr. James Simpson. Simpson introduced chloroform anaesthesia, having seen the horrors of surgery without anaesthetics. In 1827, as a medical student, Simpson witnessed a surgeon remove a woman's breast. The only thing the surgeon could offer was speed. Simpson began using chloroform on women during childbirth. Simpson had first tried it on himself with friends, a risky business that he was lucky to survive. There was of course still the danger that came with using chloroform, as it has the ability to stop the heart. Getting the right dose was essential. A great example to use would be the death of Hannah Greener, a teenager that used chloroform in 1848 during a procedure to remove an ingrowing toenail. However, having been given too much chloroform, the 14-year-old died from an overdose. Bodies began to pile up with the use of chloroform, and surgeons were scared to use it. Opposition began to grow. One reason for opposition was that surgeons took pride in their speed. Anaesthetics meant that speed was no longer important, and as such, some surgeons opposed the idea of using anaesthetics. God, or those believing, weren't happy. In a letter to the medical journal The Lancet in 1849, one Christian wrote, "The infliction of pain has been invented by Almighty God. Pain may even be considered a blessing from the gospel." And even in another letter in 1853, some said that pain built character. "Anaesthesia is most unnatural. The pain and sorrow of childbirth exert a most powerful and useful influence upon the religious and moral character of the woman." Countering opposition was vital. Pioneer Dr. John Snow helped determine safe amounts of chloroform and, later on, safe amounts for ether. He knew how much to use for pain relief and how much to use to make somebody unconscious. Snow developed the chloroform inhaler so that the patient would be able to breathe the vapour of chloroform rather than simply using a drenched handkerchief on the face. In 1853, under Snow's supervision, Queen Victoria of England took chloroform for the birth of her son Leopold, and 4 years later for her daughter Beatrice. Encouraged by this royal endorsement, the general public rapidly took to the idea of anaesthesia. Today, our expectations of medicine have been shaped by the advances of anaesthesia. Imagine an operation or even to visit the dentist without it. The quest for safer, more effective anaesthesia continues to this day. Estimates vary widely, but with the latest care, the risk of death directly linked to general anaesthesia ranges from 1 in 7,000 to 1 in 200,000. If asked the question on the significance, therefore, of anaesthesia, do consider what anaesthesia allows surgeons to do. When people realised that surgery would be pain-free, this led to an increase in the numbers of people choosing to have operations, thus allowing surgeons to have an elevated status. However, as operations took longer, there was more risk of germs entering the wound and causing an infection. As a result, the 1850s became known as the Black Period, and more deaths followed. My favourite statistic to illustrate this, if in the 1850s you were to have a compound fracture, that is an injury which a broken bone pierces the skin, there was a 90% chance of amputation, having your leg or arm cut off for instance. And then there was a 50% mortality rate. Just think, you break your leg, you're going to have your leg chopped off almost certainly, and then you've got a 50-50 chance of dying. Antiseptic techniques were much needed. But it wasn't until 1861 that Louis Pasteur discovered the germ theory, and therefore proof that it was germs in the air that causes disease was still some way off. Around 1847, Hungarian doctor Igaz Semmelweis was working in obstetrics, or childbirth, at the Vienna General Hospital. He puzzled over the pattern between two of his clinics. One clinic in particular had an unusually high incidence of the common and dreaded childbed fever, puerperal fever, now known to be a bacterial infection. The clinic was mostly staffed by medical students who had often come from autopsies, cadaver dissections and other similar duties. Semmelweis reasoned that something from the cadavers could be the cause. Semmelweis recommended that students clean their hands with a chlorine-based hand wash, and the effects were immediate. Within a year, cases of puerperal fever in the clinic plummeted. Unfortunately, because Semmelweis was not able to prove his findings and the fact he was Hungarian, there was opposition from doctors who believed that the very idea that their hands could be dirty was offensive. As a result, they did not follow Semmelweis's meticulous methods of cleanliness in an attempt to limit the spread of infection. It would take nearly 20 years for his ideas to be recognised for the outstanding contribution that they are. If you visit Hungary today and go to the National University in Budapest, it's named after him, the Semmelweis University. I would argue that Ignaz Semmelweis is the unsung hero of our course. Having read the work of Louis Pasteur, Essex-born Joseph Lister decided that he must find something to kill the germs. He also heard of a sewage farm that had used carbolic acid to reduce the smell. He made the connection that the smell of the sewage farm smelt similar to the wards of his infirmary in Glasgow, and thought that carbolic acid could be used too. A common method by Lister was to soak surgical cloth in carbolic acid and cover wounds of his patients. This allowed him to avoid amputation and for the injured area to heal infection-free. He also developed the donkey, a machine used to distribute the antiseptic in covering the operating area in a fine mist of carbolic acid. This discovery dramatically reduced his death rates by 30%. However, some surgeons opposed antiseptics because Lister had a speech impediment, and also the doctors and nurses developed rashes and they thought that cleaning was too much trouble. Opposition also came from the idea that doctors did not accept Louis Pasteur's germ theory, and there were many different opinions about the role of microbes in surgery. In the late 1860s, antiseptic chemicals had become widely used, so what Lister was offering was nothing revolutionary. His methods were often difficult and unpleasant to use. Finally, using carbolic acid is not particularly pleasant. It dries the hands and cracks the skin and also irritates the lungs. For these reasons, it was difficult to get momentum for surgeons to use antiseptic techniques. However, as time passed by the mid-1870s, the germ theory was finally starting to become accepted in Britain, and a large number of studies between 1873 and 75 used microscopic evidence and answered questions about germs. Individuals such as John Tyndall continued to promote Pasteur's work. Other individuals such as Roberts and Shane wrote papers based on the work of Louis Pasteur and Robert Koch, and by the 1880s, British doctors accepted germ theory and its role in explaining infection. Lister had introduced antiseptic methods, but by the 1890s, surgeons in Europe and North America had gone one step further: aseptic surgery. Operating theatres were no longer doused in carbolic acid in order to kill microbes. With aseptic surgery, the microbes were to be banished from the start. Surgeons had to be well scrubbed, wear gowns, and new thin, flexible gloves. All instruments were to be sterilised using steam. Face masks, rubber gloves, surgical gloves reduced infection, along with smaller surgical theatres rather than one large room. aseptic surgery depended on people wanting to accept Pasteur's germ theory, and these developments revolutionised surgery. Take a step back for a moment and realise what we have just covered. In a 60-year period, we have gone from patients being scared of visiting the surgeon, from screaming in agony during an amputation, to calm, tranquil, and infection-free surgery, all in a matter of 60 years. This is why this period now is known as the transformation of surgery. Thanks for making it to the end. I've put some practice questions up should you wish to give these a go. Leave any questions you have in the comments, because for me, the transformation of surgery is by far the most fascinating part of this course. Remember, these videos are here for your benefit, so if you liked the video, you know what to do, and if you didn't, then tell me how I may make them better. I post daily on Instagram for your daily dose of history GCSE revision, so make sure you follow along there. Make suggestions as to what you would like to see, be it on Instagram or on YouTube. Why do you think there was so much opposition to anaesthetics and antiseptic techniques? Who do you think was the greatest individual, Igaz, Semmelweis or Simpson? I'd be curious to hear what you have to say in the comments. Thanks for watching Lessons in History, and I'll see you in the next video.